Introducing the out-of-hospital template. To facilitate the GPs in completing the out-of-hospital mental health checks, a template has been designed in both EMIS Web and System 1. This video will demonstrate the key elements and offer guidance on how they should be completed. The template can be found on the patient's homepage under Auto Consult, moving down to North West London Enhanced Services and onto Mental Health. The template includes 3 main pages. The first one, Follow-up, for follow-up consultations. The second one, for healthcare assistants and nurses to complete the minimum data set. The third one, for GPs to complete the annual review. There are additional pages with information on blood monitoring requirements and also guidance on the out-of-hospital contracts and the Wellbeing Questionnaire. Page 1 of the template is to be used to record all GP follow-up consultations. It has a free text box for writing consultation notes. It also has sections for recording liaison with other mental health services, particularly consultants and primary care mental health teams. A medication review can also be marked as completed on this page. Below this, there are sections for documenting the patient's level of risk, including suicide risk, aggression risk, and safeguarding risks. At the bottom right, there are also useful links to a medicines management page, electronic pathology referrals, and other referrals the patients may require. The second page of the template can be completed by healthcare assistants who are suitably trained or practice nurses. This covers the minimum data set required as part of the out-of-hospital contract. All the elements are numerical or have drop-down options for ease of completion, and blue boxes indicate that they are mandatory fields. These include psychosocial aspects of care, alcohol intake, substance misuse and smoking status, as well as physical health measures such as blood pressure, whether a pulse is regular or not, and body mass index. Relevant blood tests results also appear here, including cholesterol, and this can then be used to calculate the Q-risk score. Please note that all patients with a Q-risk score of 20% or more should have an annual ECG done to check for QT prolongation, as this is common on antipsychotic medications. The right-hand side of the page has links to tools useful for all of these assessments, such as an alcohol screening tool, the body mass index calculator, and the Q-risk calculator. Below the mandatory section of the page, there are a variety of other indicators that it is recommended are recorded for mental illness patients. These include a respiratory screen for breathlessness, as many patients suffer from COPD as a result of smoking. There is also a link to spirometry, should this be required. NHS England also recommends that these patients are prompted to access other health checks available within the NHS, in particular the national screening programmes for cervical smears, breast cancer and bowel cancer. The I button links to the NHS Choices page where further information is available on these if required. NHS Choices can also provide details of where to access dental health screening and sexual health screening, and patients should be reminded of the importance of these checks. Below this, we also have a section on interventions where clinicians can record any advice that they give to patients, for example on alcohol consumption, diet, drugs of addiction, exercise or smoking. There is also a final tick box, referral to GP for medication review. This is to enable nurses to record when they have advised patients to see a GP about their medication, such as when their blood pressure remains uncontrolled. Page 3 of the template. This is for the GP annual review and includes a recovery and stay well plan and the Shorter Warwick Edinburgh Mental Wellbeing Score questionnaire. This page is for completion by GPs only. At the top, the Wellbeing Questionnaire can be viewed. This is a 7-item questionnaire to assess a patient's mental well-being without reference to any individual diagnosis. It's a useful tool to aid discussion of a patient's functioning and track progress year on year. There are 2 boxes for this. The upper one prints the questionnaire, and the second one opens it on the screen. You will see that each question is listed and shows 5 drop-down options as answers for each item. You can see the 7 items of the questionnaire listed, and each one opens to offer 5 choices of answer. Once completed, a total score appears in the blocks below and can be compared with previous scores appearing on the right-hand side of that screen. The score for the questionnaire is marked out of 70 on our computer system, though on the original questionnaire this is actually out of 35 and is being doubled. A score of 14 is most unwell and 70 is completely well. There is also an option to mark the Wellbeing Questionnaire as not appropriate for completion. This may not be possible when a patient has no English and/or a cognitive impairment and/or very limited insight into their condition. However, every effort should be made to assist patients to complete this, and there is a KPI requesting 90% of patients seen have a SWEMWeb score. Below the questionnaire, we have the Recovery and Staying Well plan. This needs to be completed by the GP during the consultation on discussion with the patient. It has 4 boxes entitled Signs of Becoming Unwell, Anticipatory Care Plan, the patient's goals and priorities, and finally the Health Action Plan. These are free text to enable clinicians to record as much information as they choose. Below the Recovery and Stay Well plan, there are a series of tick boxes for clinicians to indicate when checks have been completed. The first 3 are mandatory and include an indication that the care plan has been printed and handed to the patient. Secondly, that the Recovery and Stay Well plan is completed. And thirdly, that the whole annual review, including the minimum data set, has been completed. The last 2 are for QOF purposes only. The first shows that a care plan review has been completed for SMI patients, and the second that a depression interim review has been completed for patients with a new diagnosis of depression.